Hey, welcome to the Inhale Life Conversations from the Chicago Asthma Consortium. We, in this podcast, we explore people, policies, and ideas that are really shaping respiratory health and equity in Chicago and beyond. And I'm your host, Dr. Sharmili Nienhuis. I'm an asthma physician and asthma researcher at the University of Chicago. And this month we're talking about something that really has really big implications. I know for my patients, like this is a big topic is the cost of inhalers. And there's a new state law that's capping the cost of inhalers at $25 per month, which is going to be going into effect soon. And so I invited um, McKenna Mason from the Respiratory Health Association, which is an organization that has actually been at the forefront of advocacy, policy change, and education around lung health. And McKenna has been deeply involved in the work leading up to this policy. And today we'll unpack what this law actually does, who it helps, what doesn't it cover, and what patients and clinicians really need to know as it rolls out. So, McKenna, welcome and thank you so much for joining us.
Thank you so much for having me. I appreciate it.
Yeah. So, for listeners who may not be familiar, can you briefly describe what the mission of the Respiratory Health Association is and what your role is there?
Yeah, of course. So, the Respiratory Health Association is a public health nonprofit committed to clean air and healthy lungs for all people of Illinois. We were originally founded in 1906 to address the tuberculosis epidemic. Our work has evolved and shifted with the public health needs as it applies to respiratory illnesses. Today, we focus largely on tobacco use, vaping, COPD, and clean air issues. Our work includes research, policy work, advocacy initiatives, and educational programs. So I am the manager of policy and advocacy at RHA. I work with policy across the state. I track legislative processes, work with other coalitions to advance policy across the state. And I also run and manage our advocate program and find ways for people to get involved in our work.
Okay, great. That's really amazing to hear all the work, and I really love how the RHA is really kind of adapting to what the needs are of its constituents, which are people living in Illinois. So,
Yeah.
so what problem was Illinois really trying to solve with the $25 inhaler cap?
So it's no secret that healthcare prices are rising. Everyone's feeling the brunt of it. National average medical costs for individuals with asthma is an extra $1,830 a year. And 25% of those individuals are unable to fulfill their prescriptions due to cost. There are over 1.5 million Illinois individuals that suffer from asthma and COPD because when you're talking about inhalers, a lot of people just think about asthma. It does apply to these other chronic illnesses that have to do with respiratory. Rates of individuals with these respiratory illnesses are higher in areas with higher pollution rates, which traditionally are home to a larger population of minority communities with less resources available. These medical costs that are being applied to these already big healthcare things are widening that dividing gap when it comes to economic well-being in these communities. People are choosing between refilling their medication and paying rent, buying groceries, which is not something that should be happening. You're reducing emergency room cost, your lost productivity and missed work. This law is all about helping to reduce these barriers for individuals with these chronic illnesses and hopefully make life a little bit easier as well as increasing the accessibility.
Yeah. Yeah, I know when I first heard, I think when the bill was proposed and then when the bill was passed, I was like amazed to see that. I was like, "Oh my goodness, this is such a big problem." And finally, somebody's doing something about it.
And
So,
before I was working in this space, I had no idea. I had kids in my school who had asthma and they would carry around their inhalers, but then I'm doing this work and I'm like, oh my goodness, one of these things can cost like $400. Like I know I don't have an extra $400 lying around to go and get something that I may or may not need. Like it's hard. It's a choice for people.
Yeah, yeah. Are there any like stories that stick out, from patients about how, the inhaler costs influence really how they manage their condition? I know you mentioned like, having to sometimes decide between like food and paying for medications, but.
Oh yeah, just last year we had that national headline of the 22-year-old Wisconsin man who died in an asthma attack after he was unable to refill his inhaler. He had been paying $66. He goes to the pharmacy on January 10th, and all of a sudden it's $530. And he doesn't refill it because their pharmacy doesn't have any other alternatives. He can't pay that. And 5 days later, he dies of an asthma attack.
Wow.
I've had several conversations with people in our networks that, or people that I work with, and people even in casual settings that are like, yeah, I mean, I just chose, no, I've been carrying around my expired one. I haven't gotten another one. Now that I'm working in the space, I'm like, oh no, that's so bad because you can't predict when you're going to have an asthma attack. You can't predict the time that you're going to need that. And all it takes is one time that you don't have it. And you can end up in the hospital or even worse. And you don't outgrow asthma, contrary to popular belief. So I feel like a lot of the stories I do hear is like, oh, I had asthma as a kid, but I don't really need it now. Like it's fine. But that's not true. You don't outgrow it. You might have less attacks, but it's not going to go away forever.
Yeah. Yeah. So let's get into the policy itself. So if you can explain in plain language what the $25 inhaler cap law actually does.
Yes, so actually the name and what we're calling it is pretty self-explanatory. It caps the cost of an inhaler, a 30-day supply of a single prescription inhaler to $25. The law is an amendment to the insurance code, so it has to do with how insurance companies charge for the product. But ideally, in perfect world, you go to the pharmacy counter and you are not paying more than $25 for your 30-day prescription.
Okay. And so does this cap apply to like all inhalers or only certain types?
Yeah, so we are seeing right now, we haven't seen anything. There's nothing in the language that distinguishes between types. So
Mhm.
all
Okay.
types should be covered by it. We are seeing that there's a possibility of it not working for high deductible plans. RHA has people looking into that right now. We have had supporters call us and tell us like, oh, our pharmacies are honoring this. Oh, they're not. So we have had a couple people that it hasn't, and we've been trying to figure out why that is, and we think that that could be a possibility. So we have people currently looking into it right now.
Okay. And when does this law go into effect? Like, has it already happened?
Yes, it went in January 1st.
Okay.
So anytime after January 1st, you go to your pharmacy should be honoring it.
Okay. Okay. So is there anything that people need to do if they do go to there and then find out like they're, quoted $200 or 150? Is there something that like, what should patients do?
So we have reached our RHA has reached out to the Illinois Pharmacist Association to
Mm,
ask them to do more education around it.
mhm.
People are encouraged to reach out to their pharmacist, talk to them, since the bill is an amendment to the insurance code, like I talked about earlier, you should file a complaint with the Department of Insurance, and which RHA is also in contact to make sure that they know what's going on, what pharmacies are doing this, what aren't, so that they can step in.
Okay. And I guess this kind of goes to a little bit what you mentioned as far as like, who is really eligible for the $25 cap. But as far as like thinking if, somebody is privately insured or has a state plan or Medicaid, it applies as far as does it apply to all of those or only certain ones?
It should apply to everyone. The only thing that we're seeing is that there's a possibility with high deductible plans, but it should not matter what insurance you have.
Okay. And then how would it affect people who need multiple inhalers each month?
So the language of the bill states it covers a 30-day supply.
Okay.
So you're going and getting your 30-day supply. I'm not sure, like I know that there are probably people out there that go and get them like they get for the next 3 months, they go one time, they get theirs. Um it, right now it says 30-day supply. So we have yet to see how that applies at the pharmacy counter.
Okay, yeah. So it sounds like I would imagine because some of our asthma and COPD patients both like are maybe on multiple inhalers, like maybe they have a rescue inhaler or like multiple controller inhalers in addition to that. So it's I think a $25 cap for each of those inhalers. It wouldn't be for like all the inhalers is combined is
Yes,
$25.
exactly. So it's to each one.
Yeah. Okay. And then, what would you say some of the biggest risks or challenges that you've seen are happening, as this policy rolls out since it is so new?
And I kind of talked about that just a little bit. Like it's
Yep.
seeing this implementation. It is making sure that pharmacies know this and that the insurance companies are honoring it. People so that people don't go out and continue to pay these high rates when legally they're not supposed to be. So
Mhm.
it's just the implementation of the education, making sure that everyone's being charged the same.
Yeah. Okay. And then I know you mentioned you guys are working with the state like pharmacists association, but what are some other ways like that clinicians or schools or other community organizations can help spread awareness about this change?
So clinicians are already and should continue to inform their patients about this. That's going to be a lot of people's primary mode of information. So that's super important that they're on top of it and they're explaining to patients that and not just assuming they already know about it. We're working to send out information to Illinois school nurses so that they can ensure parents and students know about it to try to cover a lot of that population.
Mhm.
Community organizations can make an informational page available, and the big thing is making it as accessible as possible. I know RHA has a page on our website. We've been doing some social media posts around it, just pushing out to their individual networks because you just can't assume that everybody knows about it already. Obviously, if people involved already don't even know about it.
Yeah, yeah. I mean, I think definitely too, again, being a clinician myself, I mean, I am very kind of like on top of this because a lot of my patients have asthma, but I'm thinking that maybe not all clinicians know about it. So I definitely think, you know, I guess me now that I know about it quite well, after this conversation, hopefully, I will go ahead and definitely share it with my colleagues. So yeah, yeah. And did RHA have a role in like helping move this policy forward or this amendment to the law as you mentioned earlier?
Yes, so I will admit that was before my time. I have been at RHA for a little bit over a year, and this happened before I came over. But
Mhm.
RHA did have a very big, RHA and ALA did have a very big impact in moving this forward. So advocacy groups typically work by they listen to what the community is saying. We ask them, what's something that would make your life easier? What is something, how can we help you? What's going on in the world that you're like, this could be fixed? And a lot of people just assume that their current state of being is all that it is. But you can change things, like you can pass things at a policy level. So we take what these people say, what they're telling us, and we start to brainstorm what we can do at a state level. And then you start working with the legislator who believes in what you believe in, such as Maddie Hunter with this whole amendment. And you talk about it with other groups who share your common goals. And together, you put a bunch of people together, you start calling people, you send emails, and you don't stop until you cross the finish line. And it's important to you. Like legislators have to listen to you. So if you're loud enough, they will.
Mhm. That's really great. That's a great example, of working with advocacy organizations to really get something pushed through. So now, you know, I'm wondering, is Illinois unique here in this type of new policy, or are we seeing similar inhaler caps in other states as well?
So Illinois is not unique. Several other states have passed laws. Washington, New Jersey, and Minnesota have passed similar laws that range from $25 to $50. New York actually just passed legislation that is going to make inhalers available at no cost. That goes into effect next January. I know, right? Isn't that great? Um,
Yeah.
and then there has been discussion about changing pharmacy benefit practices in the US Senate and the House that would directly impact these medications. So there is a possibility of something moving at a federal level, which obviously would be fantastic. And then some larger inhaler manufacturers, such as GSK and AstraZeneca, have announced a $35 price cap for eligible patients, and that was back in 2024.
Oh, okay. Yeah. Well, that's great. So it is nice. It seems like others are doing similar things and hopefully maybe working at the federal level as you mentioned. So, So now kind of like looking ahead, what's next on RHA's policy or advocacy agenda related to asthma and respiratory health? Like what are some of the things that we can be on the lookout for? So yeah.
So we right now, we are actually helping to push an amendment that has to do with albuterol in sporting events. Um, we RHA is leading it alongside the Christopher D. Redding Asthma Foundation.
Mhm.
Yes, Helen is
Yeah.
fantastic.
Yeah,
To
yeah.
introduce an amendment that would require trained individuals and asthma medication to be available and accessible at any school-sponsored sporting event. And that is another example of advocacy. We hear about an issue in the Illinois Schools program that RHA helps along with AIR. We have seen over half of our cases with these rescue inhalers being used are due to physical education and moving around. Sorry, my
Yeah.
Teams just popped up and you went away for a minute.
Oh, okay.
Um, Tobacco and vaping are always a concern. We've seen a disturbing increase in the use in younger populations as celebrities have kind of gone around and starting glamorizing the habit. So that's on like a societal issue. So RHA is always continuing to be at the forefront of education with that. At the federal level, RHA is currently and works with several other coalitions to support the SOAR Act or the Supplemental Access Reform Act. This bill addresses barriers to accessing life-saving oxygen and respiratory therapists. It would take oxygen and oxygen supplies off Medicare's competitive bidding process and instead proposes a new reimbursement system so that prices are a little bit more predictable and hospitals have more access to them. And it would also bring about a patient's Bill of Rights.
Sounds good. And so, kind of as we're starting to wrap up, what is the one thing you most want patients, families, and clinicians listening today to remember about the $25 inhaler cap?
So now it's the law, and insurance companies have to honor it, whether they like it or not. So go get in contact with the Department of Insurance if this is not being honored, because it should be. And don't just be like, okay, well, it's easier. Like this is something that should be happen. A lot of people have worked really hard to bring down the cost of inhalers over the past because traditionally been way too high. They've been way too high for so many years, and a lot of people have put a lot of work into bringing the prices down. So we need to do whatever we can to make sure people actually know about this and reap the benefits of it. And if you listen to this podcast and you have any questions or any interest about getting involved or work, any more questions about it, please visit RHA's website or reach out to myself at mmason@resthealth.org, and I'd be happy to help put you in contact with anybody that I need to.
Okay, great. Yeah, we can definitely include your information too, along with the podcast. So. Well, McKenna, thank you so much for really breaking this down and also the work for the work that you and the and RHA are doing to make respiratory care more affordable and accessible. As I mentioned, for our listeners, we'll include McKenna's email. So if you do have any questions about the $25 inhaler cap, who it applies to, where to go if you have questions or run into problems at the pharmacy. If you found this episode helpful, please share it with a colleague, a patient, or a family member who might benefit from this information. And we look forward to having you listen to our podcast next month, which we will actually be talking to Helen Redding from the Christopher Redding Foundation on exercise and asthma. So thanks again for listening, and until next time, breathe easy.